Have you ever felt that your child is different, but you just can't pinpoint what exactly is going on? You see your child constantly running, unable to sit still for even 5 minutes. Or on the contrary, your child seems to live in their own world, avoiding eye contact, uninterested in making friends with peers. You begin to ask yourself, does my child have ADHD or autism? Or maybe both? Or am I just imagining things? If you're feeling confused, exhausted, or even blaming yourself, you're not alone. Millions of parents are walking this same path. And in today's video, we're going to explore a question that weighs heavily on many parents' minds. How can we tell the difference between ADHD and autism? ADHD and autism are often confused because both are neurodevelopmental disorders that usually appear early between the ages of 2 and 5, a critical time when many social and behavioral skills are still developing. The early signs of both conditions can show up through difficulties in communication. Children may not respond when called, avoid eye contact, or speak in unusual ways. Both can also lead to challenges with emotional regulation. Children may become easily irritated, throw sudden tantrums, or overreact to minor changes in their environment. Socially, children may struggle to join group play, not know how to start a conversation, or fail to grasp common social rules. Additionally, signs like inattention or hyperfocus on a specific object or topic can appear in both ADHD and autism. All these overlapping features make it difficult to tell the two apart with the naked eye, especially when parents lack specialized knowledge. Because of these similarities, many parents and even teachers or healthcare professionals may initially confuse ADHD with autism. However, with closer observation, there are clear differences in how each child reacts to the world, learns, interacts, and expresses emotions. For example, children with autism often struggle significantly with understanding and using social communication. They may not know how to engage in pretend play, show little interest in sharing experiences, or not use gestures or eye contact to connect with others. In contrast, children with ADHD are usually eager to interact, but struggle with impulse control, often interrupting, speaking out of turn, or not listening attentively. Another key difference lies in behavioral flexibility. Children with autism tend to show repetitive behaviors, a strong preference for routines, and difficulty coping with changes. Meanwhile, children with ADHD are easily distracted, quickly bored, and frequently switch from one activity to another. Emotionally, children with ADHD often express their feelings suddenly and intensely, but also quickly forget and move on. Autistic children, on the other hand, may show little emotional expression or may display emotions that don't match social situations. Another important clue, children with autism often have deep obsessive interests, such as a fascination with trains, maps, or numbers. Children with ADHD, however, usually struggle to maintain long-term interest in anything and frequently shift focus. In terms of movement, children with ADHD typically show clear signs of hyperactivity, running, jumping, unable to stay still. Children with autism might repeat actions like flapping hands, spinning, or even self-harming as a way to self-stimulate. Being able to tell these two conditions apart is crucial because the support and intervention strategies differ greatly. If a child with autism is misdiagnosed with ADHD, they may miss out on essential support in language and social development. Conversely, if a child with ADHD is mistaken for being autistic, they may be restricted from building independence and confidence in learning and life. That's why understanding the differences is the first step for parents and caregivers to choose the best path for a child's development. In reality, some children may have both ADHD, attention deficit hyperactivity disorder, and autism, ASD. This is called a dual diagnosis, meaning a child clearly shows signs of both neurodevelopmental conditions. According to many studies, 30 to 80% of children with autism also show symptoms of ADHD and vice versa. A significant percentage of kids with ADHD may also have traits from the autism spectrum. Having both conditions at the same time makes diagnosis and intervention more complicated. For example, a child might be extremely energetic and talkative hallmarks of ADHD, but also show repetitive behaviors and obsessive interests typical of autism. That's why it's vital for parents and professionals to take a holistic view, not overlooking any signs, in order to develop the most appropriate support plan. Early and accurate diagnosis helps avoid confusion and builds a much more effective intervention path. So what should parents do when facing a diagnosis of ADHD autism? Or both? The first thing parents need to do is stay calm and accept the information objectively. It's normal to feel worried or even denial, but those feelings won't help your child move forward. What matters most is reaching out to trusted professionals, including child psychiatrists, psychologists, or behavioral intervention specialists, to get a comprehensive and accurate evaluation. Next, parents should proactively educate themselves about these conditions. Understanding exactly where your child struggles with attention, social interaction, or emotions will help you make the right decisions about interventions and education. Remember, there is no one-size-fits-all method. Each child needs a tailored path based on their strengths and challenges. Creating a stable, loving, and patient environment is the foundation. Your child may struggle to manage emotions, stay focused, or connect with others, but with consistent support from you, they can grow step by step. Whatever challenges your child is facing, whether it's attention issues, communication difficulties, or emotional struggles, the most important thing is your patience, understanding, and presence. No one can replace the role of parents in shaping their child's future. If you found this content helpful, don't forget to hit subscribe so you won't miss more in-depth, trustworthy insights on supporting and caring for exceptional children. Because the more we understand, the better we love. Thank you for your time, and see you in the next video,